Hi, I'm Kelly Thompson, and I will be doing a speech on hypothyroidism. Many people with undiagnosed hypothyroidism assume that what they are experiencing is from exhaustion, but what they do not know is that it could be substantially more serious. Hypothyroidism, otherwise known as the underactive thyroid disease, is an extremely widespread disease. It affects about 10 million Americans today. It is becoming more and more common. Approximately 1 out of every 10 females has some grade of a thyroid hormone shortage. The main purpose of the thyroid gland is to make the metabolism work correctly and most effectively. People often ask what hypothyroidism is. Hypothyroidism is a condition characterized by abnormally low thyroid hormone production. It happens when the hormones are not able to be produced. The chemical reactions in the human body become exceptionally distressed in a person with hypothyroidism. If thyroid imbalances such as this occur, many people tend to believe their symptoms will worsen. If symptoms seem to be really bad, it may mean that the thyroid hormone has a shortage. Because of this shortage, it could eventually lead to other, more serious symptoms. This particular gland has a unique shape. It is positioned on the inferior part of the neck. The gland essentially sticks to the trachea like a butterfly-shaped band-aid. The pituitary gland controls the thyroid. This larger, more in-control gland is positioned in the middle base of the brain. The pituitary gland is divided into 3 lobes: anterior, intermediate, and posterior. Although hypothyroidism is particularly common, it can be hard to detect. Many of the first signs can be thought of as being normal, everyday happenings. There are many physical signs that are internal. First of all, the reflexes become more sluggish. Body temperatures tend to be lower in a person who shows signs of hypothyroidism. Also, the heart may seem to beat slower and palpitations may appear. Palpitations happen when the heart beats at an irregular pace. It may feel like it is beating too fast, too hard, skipping a beat, or what they call fluttering. They come on more often if the patient tends to have stress and/or anxiety. On the other hand, there are many physical signs externally. People showing signs of the underactive thyroid disease may have protruding eyes. There also may be some puffiness. Hair changes is another sign. The hair might become coarse, and there could be a serious loss of hair, not just from the head, but from the eyebrows and armpits. A hoarse voice is yet another sign. While the signs are thought to be normal, the symptoms are a little more troubling. The symptoms of hypothyroidism have to do with the body changing and perhaps doing what it should not do naturally. There are also many physical symptoms. Hypothyroidism does not come on or act the same in anybody. Symptoms might differ depending on the person. Symptoms come on gradually, and they take time to develop and show. The longer hypothyroidism is left undetected, the more serious it can be. And if it's left untreated, it could be deadly. While the metabolism of the human body decelerates, the symptoms become more apparent. There is also unexplained weight gain, constipation, abnormal swelling, tiredness, muscle and joint aches, eye and ear issues, sleep apnea, and headaches are all common symptoms, as well as low body temperature, the feeling of being cold even when in warm climates, having a hard time concentrating, and hair changes. The hair changes are the same as listed before. As if hair problems weren't enough, the nails are also affected. It could cause the nails to become dry and crack, and since they are dry, they break off easily. However, there are some mental effects of hypothyroidism too. Depression and anxiety often occur in patients who are unaware of having the disease. Other examples would be mental sluggishness, forgetfulness, emotional uncertainty, no ambition to do the things the person loved to do before. They might also become extremely irritable, even about the smallest things. In some cases, people develop agoraphobia. Though hypothyroidism is a common disease, gender is a factor that majorly affects it. The signs and symptoms seem to be quite similar in adolescents and adults. Women have more of a chance to develop this disease, although men can still get it, and so can children. On average, 1 out of every 50 women becomes diagnosed with hypothyroidism when they are pregnant. 6 out of every 100 miscarriages are connected with thyroid malfunctions. 20% of women age 40 and above whom have higher cholesterol levels than normal have hypothyroidism. The underactive thyroid disease is more common in adults over the age of 60. Hypothyroidism often occurs more than not in people who have a family history of the disease. Having an immediate family member with a thyroid problem makes it 50% more likely for another immediate relative to have it. Some people may think their relatives have dementia because of Alzheimer's, but in reality, it could be from hypothyroidism not being treated. Also, infections may occur more often because the disease depresses the body's resistance to them. Along with medication, or instead of medication, physicians will suggest therapy. Therapy can be in many different forms, such as yoga. Yoga applies disciplines to the physical, mental, and spiritual minds. The goal is to achieve a state of peace eternally. Psychotherapy could be another option. Once the patients figure out the way they cope best, they can better the situation. Before psychotherapy can happen, the patient and psychotherapist must form a trusting relationship. Another type is prayer and mental healing. This is a process of healing from another human's hands. They modify the state of consciousness of the person through spiritual knowledge. Self-hypnosis is self-encouraged. It is a learned routine, which helps the person develop deep presence of themselves. Also, journaling can be another form of treatment. When a patient writes down their feelings, they have a chance to express how they really feel. They can write down exactly what's on their mind and not have to worry about other people reading it. As long as people who are diagnosed with hypothyroidism acquire the medication or treatment they need, they will be able to live a happy and normal life. Thank you.